Well, my name's Jason Folk. I'm an orthopedic surgeon with the Steadman Hawkins Clinic of the Carolinas. I've been with the clinic since, for the most part, since the inception here in Greenville. Over the course of the last 5.5 years, I was with the clinic up in Vail, Colorado with Dr. Steadman and Dr. Hawkins, where I did my fellowship, and subsequent to my fellowship, spent time at the office there before being sort of recruited to South Carolina by Dr. Hawkins. I realized early on in medicine that I wasn't going to be your sort of classic, doctor that you went to, and I picked orthopedics for that reason. I get to be hands-on. I'm more of a hands-on kind of person. Kind of grew up working with my grandfather, doing a lot of carpentry and those kind of things, and the place where I saw carpentry and medicine was in orthopedics. My practice, for the most part, breaks down to probably the bulk, at least 2/3 right now, is knee surgery, arthroscopic knee surgery, ligament reconstruction, meniscal surgery, and then the remainder is primarily hip arthroscopy and doing various surgeries there. But that field is sort of evolving right now. A lot of interesting new. Our understanding of hip arthroscopy is expanding, and we're currently sort of in the, I won't say the infancy, but the pre-adolescent years of hip arthroscopy. So it's an exciting time to be a part of it, and have found it very rewarding. What I do, I think I do it very well. I've sort of selected a fairly narrow practice range that in the type of surgeries that I do are fairly narrowed, and for that reason, and I feel like I do what I do because I'm good at it, and I do a lot of it. I went to undergraduate at the University of Texas in Austin. Subsequently went to medical school at the University of Texas Southwestern in Dallas, where I did also my residency in orthopedic surgery at the University of Texas Southwestern in Dallas. As part of our chief resident year, we spent time in England and working for the National Health Service, doing waiting list surgeries, which is a valuable experience. It empowers you and gives you the confidence to move to the next step in taking care of your own patients and applying what you've learned. I did a fellowship at the Steadman Hawkins Clinic in Vail, Colorado, which is where I first became involved with the U.S. ski team. Subsequent to my initial fellowship, I did a mini fellowship in complex knee multi-ligamentous reconstruction at the University of Pittsburgh. UPMC Medical Center with Dr. Harner, and subsequent to that was asked to stay at the Steadman Hawkins Clinic in Vail. Was there for about 4 years before deciding to make a change and come to the Steadman Hawkins Clinic of the Carolinas at the urging of Dr. Hawkins. I've been a doctor for the U.S. ski team, and specifically when I first started was with the women's alpine team, but now I'm for the most part with the men's alpine team. I've been doing that for the last 10 years, got involved with that when I was first in my fellowship in Vail, and have been doing it ever since. We travel with them as a team physician on an annual basis, usually for World Cup races in Europe and some training camps in South America and in New Zealand. So it's fun in that respect, getting to travel and see new places. It's also been, very rewarding, kind of even in growing up as a ski racer. What they do is completely different. They take it to another level. I have a genuine appreciation for what they do, and it's great. It's fun to experience, but it's also scary as the physician who's responsible for them if they should go down at 90 miles an hour or so. Spent a lot of time at races in Europe, and then early on during my fellowship, we looked after the ski team at Salt Lake City when the Olympics were there. I think most academic centers are at the forefront of medical care. They're the ones doing the research. They're the ones teaching, again, the next generation of physician the newest techniques, the most recent information and literature that's out there. I think it's critically important. Otherwise, I think out in practice you tend to get into a rut, I should say, where you're less inclined to kind of look at new ways. You know, this is something that I've always done. It works well for me. Less inclined to look at the new ways that may be better for you. You know, and if you're not in an academic environment, I think the impetus to do that is far less. Well, I'm passionate about my family. My wife, Jennifer, my daughter, Molly, who's 7.5. After having spent a lot of time in a big city like Dallas, the busyness there, and then really the slowness of, say, living in Vail for a period of time and the isolation of living in Vail, Greenville's a perfect place. It's 4 seasons, it's, the size is perfect, and I've actually, you know, grown sort of protective of it, and you know, fearful when you see it in magazines that, all right, you know, we don't want that to get out there too much. Kind of keep it what it is. It's a wonderful place.